Meconium Aspiration Syndrome, MAS, is a critical neonatal respiratory condition that demands our attention. This presentation aims to shed light on the causes, consequences, and management of MAS, a condition where a newborn inhales meconium, their first stool, into the lungs before, during, or after birth, leading to respiratory distress. Meconium, the thick, greenish-black substance that fills a baby's intestines during fetal life, can sometimes be released into the amniotic fluid when the baby is stressed or in distress. This presence of meconium in the amniotic fluid can signal fetal distress and can have an impact on the baby's lung function if inhaled. Several risk factors contribute to the occurrence of MAS. Post-term pregnancies, difficult deliveries, and instances of fetal stress can increase the likelihood of meconium aspiration. Additionally, maternal factors such as smoking, diabetes, and high blood pressure can play a role. Clinical presentation of MAS includes rapid and labored breathing, bluish skin, cyanosis, nasal flaring, grunting, and chest retractions. These signs of respiratory distress indicate the possible inhalation of meconium. Diagnosing MAS involves clinical assessments, physical examinations, and chest X-rays to evaluate lung function and identify any lung damage. Blood gas analysis helps assess oxygen and carbon dioxide levels in the blood, which can aid in determining the severity of the condition. Complications of MAS can vary, ranging from lung damage and respiratory distress to potential infections. The severity of the condition can range from mild cases that require minimal intervention to severe cases that demand immediate and intensive medical attention. The treatment and management of MAS focus on clearing the airways, providing oxygen support, and ensuring proper lung function. In severe cases, mechanical ventilation might be necessary to help the baby breathe effectively. Additionally, antibiotics can be administered to address any potential infections. Prevention strategies involve closely monitoring high-risk pregnancies and intervening during delivery if meconium is present in the amniotic fluid. Timely recognition and response can contribute to preventing the inhalation of meconium. In cases where MAS is diagnosed, many infants require admission to the Neonatal Intensive Care Unit, NICU. Here, they receive specialized care, continuous monitoring, oxygen therapy, and any necessary medical interventions tailored to their unique needs. The emotional impact on parents cannot be underestimated. The diagnosis of MAS can lead to feelings of anxiety and concern. Providing parents with accurate information, maintaining open communication, and offering emotional support are pivotal aspects of managing the emotional toll of MAS. Prognosis and outcomes largely depend on early diagnosis and appropriate management. With timely medical attention and intervention, most infants recover fully from MAS and go on to lead healthy lives. In conclusion, Meconium Aspiration Syndrome presents a neonatal challenge that requires swift action. By promptly recognizing the signs, providing necessary medical intervention, and implementing preventive measures, healthcare professionals and families can work together to ensure healthier outcomes and brighter futures for infants affected by this condition.